Diabetes is a chronic disease that has been with us since time immemorial, and its prevalence seems to be increasing as the years go by. In 2016, WHO estimated that diabetes is the 7th leading cause of death worldwide. Did you know that? Diabetes is the leading cause of kidney failures, and adults with diabetes have increased risk to stroke and heart attack. In this episode, we will delve into this chronic disease, the causes and its management. This show is proudly sponsored by MNC Group, Prince Syrup, and Nido. There's no love like the mother's love. No one can protect them like you do. And now more than ever, it is important to protect our kids from anything that will make them sick. That is why Nido is fortified with iron and vitamin C and D to help support their immune. So choose good nutrition. Choose Nido. Nido, your love, their future. Let's go for a breather. When we come back, we start our discussion for today. Welcome back. Today I have with me Dr. Robert Quay-Instro, a medical doctor from Kolebu Teaching Hospital. He is here to share his knowledge on diabetes with us. Doctor, you are welcome.
Thank you.
So, according to research, a lot of people are living with diabetes. And what does it mean to have diabetes?
So, like you rightly said, diabetes is a chronic illness.
Okay.
And so, let me try and make it a bit simpler. So, when you eat, whatever food that you eat, your body is going to absorb it. Mm-hmm. You need insulin to move the glucose into the cells. So for diabetics, they don't have the insulin, or for some who have the insulin is not able to do its work. Okay. So glucose becomes much more in the blood. So you have increased blood glucose. And that perpetually stays on for as long as it is undetected. Okay. And that can cause damage to a lot of organs. So basically, diabetes, you have high blood sugar. It's a chronic illness that needs to be diagnosed early and treated.
You mentioned insulin. What is insulin?
So insulin is a hormone that is produced in the body.
Okay.
Its main job is to get glucose from the blood into the cells.
All right.
So that is the main area of interest when it comes to diabetes.
Okay, so meaning it's all about the insulin?
It's mostly about the insulin.
Mostly about the insulin. So, Doc, what is the normal blood sugar level of a person before eating and after eating?
So before eating, which we call the fasting blood sugar, the normal sugar level should be between 4.0 to 6.0 millimoles per liter. Okay. However, after eating, it goes a bit up, so the range changes. So you have from 4 to 7.8 millimoles per liter. Anything below or above is abnormal. Right.
And does it occur to all race equally?
No. So there's like for most other diseases, there are racial disparities. Okay. So so diabetes, we have different types of diabetes. So let's say if I take type 2 diabetes, the prevalence amongst races are different. So it's more common amongst Africans, African Americans, and Asian Americans as compared to the Europeans.
So why is the type 2 common among certain people?
So you have to go back to what predisposes people to diabetes for both the type 1 and type 2. So for the type 2, they are, apart from being genetically predisposed to getting type 2 diabetes, there are other things that can...
Doc, wait, genetically predisposed, what do you mean by that?
So there are certain genes that, let's say you are born with. Okay. You understand? So you are born with you. So let's say if your father or your parents or you have a first degree relative who has a diabetes, you have a higher chance of getting diabetes than somebody who doesn't. So those genes are there. But those genes alone do not make you get diabetes. You understand? So the cause is multifactorial. When I say multifactorial, it means that the other things have to come into play together with the genetic predisposition to get it. You understand? So like you're cooking something. If you're cooking jollof, you have rice. You don't just use the rice. Other things come to play to make it like that.
Yeah, that's
so
true.
For some people, the exercise, so let's say you're a banker, you're always sitting at home, your father is a diabetic, you already have the genes to get that. You most likely have it. Okay. Sitting almost all the time, not doing any exercise, increases your risk. Exactly. Again, you are eating late, you are eating junk food, you become overweight, obese, all those things put together increases your risk. So basically, there are certain races that are more likely to, how will I say it, are more likely to have this illness. And so if you, let's say, take a average representation of Africans as compared to Europeans, the percentage of people who have diabetes as compared to the Europeans, you see that it's more amongst the Africans, the African Americans, the Asian Americans as compared to the European.
In case my mother is a diabetic, does it mean that my brothers are likely to be diabetic as well?
Yes. So if your mother, so let's say your mother has diabetes.
Yes.
Your father doesn't. You and your siblings are at an increased risk compared to somebody who doesn't have any family history.
Okay.
That doesn't mean that you're going to get it.
Okay.
So like I said, if you are genetically predisposed, doesn't necessarily mean that you will get it.
Okay.
So you have to now make sure that the things that can come together to make you get it are not there.
Okay.
Regular exercise, eating,
that's
balanced
your lifestyle.
diet. Yes, the lifestyle modification, lifestyle changes, very, very important.
Okay. So I've seen a girl at the age of 11 years with diabetes, and I've seen older people with diabetes. I've seen pregnant women who were not previously diabetic, but then when they got pregnant, they became diabetic. So what causes diabetes?
Okay, so let me just start. You've seen a little girl with diabetes. So type 1, basically, what it is that you don't have enough insulin to be able to take glucose from the blood into the cells.
Okay.
For type 2, you have the insulin, but the insulin are not able to, it's not able to do its work because the receptor that the insulin is supposed to work on is not sensitive.
Please, what is a receptor?
So let's say you have this. So this is the insulin.
Okay.
And then the insulin is supposed to attach to this before it does its work.
Okay.
The insulin is there, but this is not doing its work.
Okay.
So you are not able to signal and then take the glucose from the cells.
Okay.
So this child you're talking about most likely has type 1 diabetes.
Okay.
So diabetes, you can get children with diabetes and get adults with diabetes as well. So it doesn't just affect just one age group. So type 1 is mainly amongst the children, but you can also have type 1 amongst adults as well.
Okay.
And type 2 is mostly among adults. But because of our recent change in lifestyle, especially when you come to our parts of the country, we are seeing a lot more children who are obese, who are overweight. You can get children also getting type 2 diabetes as well. And you mentioned about pregnancy. So diabetes in pregnancy, yes, you can have, somebody can be normal, and then when you become pregnant, you get diabetes. The pregnancy, it's a diabetogenic state. What it means is that your body wants to make glucose available for the child.
Okay.
You understand? So there are certain hormones that will make sure that there's glucose available for the child. So if you are just one, you're okay, but now you're two. So body tries to make sure that there's a higher level of amount of glucose at all times.
Okay.
And for people who are predisposed, so let's say they have a family history of diabetes already, you can get diabetes in pregnancy.
Okay.
And so the trigger in this case is the pregnancy.
Okay.
We mentioned earlier that some people who are predisposed, it's the lifestyle changes that can add on to that and get diabetes. Okay. So in this case, the pregnancy becomes the trigger.
Okay.
So after the pregnancy, in some people, because the trigger is the pregnancy has ended, they go back to normal.
Okay.
But this is somebody that you have to pay attention to.
Okay.
Because what it means is that in the near future, if things are not put in place, this person may eventually get diabetes.
Okay.
However, in some people, after pregnancy, 6 weeks, the sugars are still high, and you have to treat them as diabetes.
Wow. And Doc, who is at risk of getting diabetes?
Good question. So in our discussion here, there are things that come together.
Okay.
So the family history, so a family history of diabetes is important. But there are other people who don't have family history who can be the first person in the family to have diabetes.
Wow.
So family history is important. And then,
but Doc, meaning the person is living on healthy lifestyle.
Yes.
So
there are other things that can come into play for you to get that. But it's not everybody's whose cause of getting diabetes is unhealthy lifestyle.
Okay.
So the type 1. Type 1 is mainly something we call autoimmune. Autoimmune is that your body is producing certain antibodies that are fighting against itself.
Okay.
So the insulin is produced by the pancreas, which is in the body. So if your body is also producing certain things that can damage those cells will not be able to produce the insulin and end up with type 1 diabetes.
Okay.
So it's not necessarily about lifestyle, but this one is autoimmune, where you don't really have any control over. It just happens. Like the child you mentioned. The child doesn't have any control over whether I get type 1 or not. So there's a genetic predisposition, and sometimes certain viral infections can trigger this autoimmune response, and then later on.
Viral infections like?
So any viral infection. So so mumps in children, mumps, measles, like any viral infection, Coxsackie virus, they can. So it's not the virus is not the cause of the. It's not the cause of the autoimmunity. So like, the person is already predisposed to that. There's a genetic predisposition to that. And then you get the viral infection. I don't want to say that the minute you get mumps or get measles and you have that, you get it. Okay. It doesn't work like that. So these are
absolute.
It's not absolute.
Okay.
So these are things that can happen that can trigger you to get the autoimmune. The antibodies now fight against the cells that produce the insulin, and end up with type 1 diabetes. So it's not always about lifestyle. However, the minute you get diagnosed with the diabetes, the lifestyle becomes very important.
Right.
Because if you are not able to follow those changes, you will not be able to get the sugar under control.
Doc, is diabetes reversible?
No. So the
both
only
type 1 and 2?
No. So it's a chronic illness.
Okay.
So for type 1, type 2, there is no, as of now, as I'm speaking to you, there is no cure for type 1 and type 2 diabetes. Okay. So it's not reversible. It's chronic. However, we mentioned earlier about diabetes in pregnancy. Okay. That, after pregnancy, can be reversed. Apart from that, for type 1, type 2, if your doctor tells you that you have diabetes, we always make it a point for you to understand that it's a chronic illness.
Okay.
So you have to be on the treatment that you are giving you and not resort to other herbal treatments.
All right. Viewers, let's go for a quick break. When you come back, we'll talk about the telltale signs of diabetes. This show is proudly sponsored by MNC Group, Prince Syrup, and Nido. There's no love like the mother's love. No one can protect them like you do. And now, more than ever, it is important to protect our kids from anything that will make them sick. That is why Nido is fortified with iron and vitamin C and D to help support their immune. So choose good nutrition. Choose Nido. Nido, your love, their future. Welcome back. Before we went on break, we were talking about diabetes and the normal blood sugar level. So, Doc, how do I know that I have diabetes?
So there are some classical things that we always ask or we always look for.
Okay.
So for people who sugars are very high, most of them, or some of them actually, they will tell that they are urinating a lot more than they're used to. So we call it polyuria. The volume is a lot. Okay. Because you are urinating more, you'll be drinking more water. So they'll be drinking more water than you're used to. Okay. They'll also be eating more. But in some people, they'll be eating more, yet losing weight. Okay. So urinating more, drinking more water, and eating more. Those are the things that the minute you see, you should try and see a doctor about it.
Okay.
There are also some other presentations that are usually much more advanced. So sometimes some people have tingling sensation, numbness of their feet, and some people who it has gone on for a very long time, they may have some erectile dysfunction, some problems with their eyes, because diabetes can affect really any part of your body.
So, Doc, what about diabetes in pregnancy? Does it have any effects on the mother and the unborn baby?
Yes, it does.
Right.
So diabetes in pregnancy can affect both the mother and then the baby, especially in unsupervised pregnancy and labor. So when we say that you have diabetes in pregnancy, you're at risk of certain things, like hypertension in pregnancy, which comes with its own problems. You're at risk of getting polyhydramnios, which basically means that there's a lot of fluid around the baby. Okay. You're at risk of getting postpartum hemorrhage, bleeding after delivery. And the baby, especially when, if you have diabetes, you get a diabetes in pregnancy. Some people, they get diabetes before pregnancy, but they don't know. Some people, they already have the diabetes before, and then they get pregnant. Okay. So those people usually have diabetes before they get pregnant. The baby can have some congenital malformations, Holy nuts amongst others. Wow. And then, but those who get the diabetes, especially if it's not well controlled, the baby can become very big. So we call them big baby. Usually when they are more than 4.0 kilos.
So not all big babies are
healthy. Yes. Okay. So some, usually so if let's say you come to my consulting room and then you tell me that, oh, your last baby was 4.2 kilos. Okay. I'll be thinking, oh no, that's a problem. Okay. Let me see whether in this pregnancy you have diabetes or not, because it's a risk factor. Okay. So if the baby is big like that and you are delivering, imagine pushing a very big baby, especially in unsupervised labor, you can get tears.
And other complications.
As well. The baby being big is not good. Okay. Because in the post-delivery period, they can get low blood sugar, which is problematic. They can become jaundice as well.
Okay.
Diabetes can also not just make the baby big, it can also make the baby growth restricted and small.
Wow. How does that occur?
So usually, for people who have diabetes before pregnancy,
Okay.
and it's poorly controlled, what it means is that the diabetes has, you have atherosclerosis, you have fat deposition within the blood cells. So perfusion to the placenta, you need the baby.
Look, just break it down for us.
Okay, I'll do that. So blood flow to the placenta is reduced.
Okay.
The placenta is what brings nutrients from the mother's side through the cord, umbilical cord, to the baby. So in people who have advanced diabetes, where you have diffuse atherosclerosis, like fat deposition within the vessels, you have placental, like the blood flow through the placenta and all that is reduced. So sometimes maybe gets placental infarcts, like the same way you can get heart attack in the heart. It can also happen in the placenta.
Okay.
So you have that's going on. Baby becomes small because it's not getting the nutrition that it's
Enough
supposed to get.
from the
Yes, and
mother.
become small.
Okay.
And then upon delivery, that being small has its own problems.
Okay.
Temperature control, glucose control, electrolytes, amongst others.
Can diabetes affect someone's reproductive system or the sex life?
Yes, it can.
Wow.
Yes.
In
So like
which
you
way?
mentioned, like diabetes can affect any part of the body.
Okay.
So in people who have had diabetes for a very long time, let's say 5-10 years, some men, so it can affect both men and women.
Okay.
So men, the more common symptoms that you hear in the consulting room is that they are not able to achieve good erections.
Okay.
And this is because of the diabetes. It affects the vessels, it affects blood supply to your genital organ. And it's not just that as well. It can also affect sperm production.
Wow.
Yes, so they can become not just not able to achieve erections, they can become infertile.
Wow.
Yes. So for women as well, the same thing is it can affect the nerves.
Okay.
And you need the nerves to achieve orgasm or something like that.
Okay.
So if the nerves are not able to do their work, obviously you can get some women with anorgasmia because of diabetes,
Okay.
failure of lubrication, amongst others. It can also
Okay.
affect fertility as well. So in some women who have diabetes, they are not able to, they may not be able to ovulate properly. Or let me not use properly. They may not be able to ovulate at all. So because of that, if you're not able to ovulate, you can get pregnant. Especially for diabetes that is not well controlled.
Okay. So how can a diabetic patient manage her condition?
So it's I believe that for any person to be like successful at managing their condition, they first have to accept that this is what it is. So there are sometimes some of the patients do not believe that they have diabetes.
Okay.
They don't accept. Because of that, they resort to certain herbal conditions. So I believe the first step is accepting that I have diabetes. If you do that, then you can work with the doctor to follow the plan for you. So the main thing really is that diet, exercise, and then medications.
Okay.
So the diet is very, very important. You should follow so if you come to me, I'll let you see the dietitian, where they'll have a plan for you regarding amounts of food you should eat,
Okay.
what types of food you should eat. If you're able to follow that, you're able to exercise at least 3 times a week, and then be very compliant on our medications and regular reviews, we should be able to get the sugar under control. And it's very important because if you're not able to do that, and the sugars remain consistently high, it can affect almost every organ in your body.
Okay.
You can go blind,
Okay.
you can get a stroke, you can get a heart attack, and the most common one that I use to scare my patients is kidney.
Okay.
Because there are so many patients now with chronic kidney disease who are requiring dialysis because they don't take their medications properly.
Okay.
And dialysis is very, very expensive.
Yeah.
So if you are somebody who really, you don't want to have to depend on dialysis because it's time consuming, money consuming, and all that. So if the minute you mention that, some people get scared enough to go back to their medications. You can also get ulcers, and we've mentioned about erectile dysfunction as well.
Okay. All right. So meaning there's no cure for diabetes?
For
from
now,
what you said.
There's no cure, but it can be managed.
Okay. But I've heard a lot of people selling herbal medicine as a cure to diabetes.
That's
How
me.
true is that?
You are doing yourself more harm than good, listening and taking unapproved herbal medications.
Okay.
As I'm sitting here now, I don't think there's any FDA approved herbal treatment for diabetes.
Okay,
So the
okay.
only FDA approved treatments are the ones that we give in the consulting room, so not the one
Okay.
that they sell in the cars.
All right.
Because those ones can also damage your kidneys. But
Exactly.
especially those ones that are not approved, you don't know what is in the medications. You keep taking. There are so many patients who have come because they've taken herbal medications and now they've damaged their kidneys or some other part of their body. So my advice to you is not listen to them.
Okay, thanks for your advice. Doc, let's talk about COVID and diabetes. Why is it that patients living with diabetes have lesser chance of surviving COVID-19?
So diabetes in itself is an immune suppressant. So it affects your immune system. It affects the white cells from doing their job. So if you get an infection, so you take somebody who has diabetes, someone who doesn't have diabetes, and they get COVID. Because the person who doesn't have diabetes has a stronger immune system. They should be able to fight off the COVID much more effectively and efficiently than somebody who has diabetes with immune compromise.
Okay.
So because your immune system is able to fight that virus, it spreads, and then the more it spreads, the more damage it causes, and then your risk of dying is higher than someone who doesn't have diabetes. So it's basically about diabetes affecting your immune system, affecting the body's fight against the virus.
All right. So, Doc, before you leave, what do you have to tell our viewers concerning diabetes?
Diabetes is a chronic illness, and my message to everybody is that you listen to your doctors. If your doctor tells you to see the dietitian, kindly do, take the medications, and then listen to the dietitian's advice. Try as much as possible not to take any herbal medications which really are not approved by the FDA. And as much as you can, try and then regularly visit your doctor. There are some people who have diabetes who know their medications, so they can go to the pharmacy and buy the medications. But when you go for regular reviews, you don't just refill your medications for you. You monitor the effects of diabetes, whether it's progressing, whether it's causing any damage, whether we have to do something about your medications or not. So regular reviews, follow your dietitian, and as much as possible, if you see any of the signs that we mentioned earlier on about urinating more, eating more, and then drinking more water, try and see your doctor to evaluate you to see if you have diabetes or not. And if you have a family history of diabetes, know that you are at increased risk. Okay. So as much as possible, try as much as possible to reduce the junk food, late eating, try as much as possible to also exercise to make sure that you don't get to where we all don't want you to get.
All right. Oh, thanks for your advice.
You're welcome.
We really appreciate it. Viewers, Doctor is a medical officer at Kwelebu Teaching Hospital. So if you have more questions for Doctor, kindly drop it on the number on your screen. This show is proudly sponsored by MNC Group, Prince Syrup, and Nido. There's no love like the mother's love. No one can protect them like you do. And now more than ever, it is important to protect our kids from anything that will make them sick. That is why Nido is fortified with iron and vitamin C and D to help protect their immune. So choose good nutrition. Choose Nido. Nido, your love, their future. Let's go for a breather. When you come back, we'll join dietitian Nee for some healthy eating habits for diabetics. Here is the dietitian scanner. As we
all this provides. Now, when you come to the whole grains, we also have the oat
health.